All right, part 2. Now we're going to shift our focus to talking about hair, and we're going to use a real life case here from this elementary school. So this is an actual letter, not to me, but you'll see. So the letter reads, "Dear ABC Veterinary Clinic, I'm a 3rd grade teacher in your local school district, and on Friday I brought my dog Bailey to class. I explained that because Bailey is a poodle, she does not shed. I asked if anyone had questions about Bailey, and there were the usual ones. What does she like to do? Does she know any tricks?" Then one girl asked, "Why don't poodles shed?" I answered with a rather pat answer, mumbling something about genetics. It was not a great answer. I promised them I would have a better answer by Monday. Please help. Signed, Rebecca Osterhausley, 3rd grade teacher. So to answer this question, why don't poodles shed? There's a few things we'll have to answer. So, what actually are hair strands and follicles? What is meant by a top coat and under coat? What sort of patterns do we see with shedding? How does hair know when to stop growing and to start growing? So, I didn't complete this slide, I realize now. So, what is going on? Take a moment, you can look at your own hair. Okay. There's different parts to your hair, right? So you've got this hair shaft, that's the part that's above the skin. You got this root that's buried below the skin. And then the follicle is this, we say it's an invagination. It's just this, almost like this little infolding of the epidermis that extends to the dermis, and that is where the hair is anchored. It's anchored inside the follicle there. And hairs usually have more than one hair. I'll show you a picture later of that. Just for simplicity, this one just has the one hair. And this thing down here, my understanding, this little structure here, this hair is still actively growing, because this thing here is kind of the blood supply to the, basically like a blood supply to that hair. But you'll see that in a moment. I guess we call that maybe that's actually the dermal papilla. Maybe that's what that is. But what it is, it's mitotically active, right? It's this these rapidly dividing epithelial cells, and just like you saw, they're going to push upward and become keratinized and die. So what you're looking at here, this is a hair follicle. Yeah, it's a hair follicle with nothing in it, right? It's like you just plucked a hair out, and this is going to grow into a hair. So these mitotically active epithelial cells, they push up, they get keratinized, and here comes this brand new hair, right? You remember I said most of the time there's more than one hair in a follicle. And dogs have these things called primary hairs and secondary hairs. And I'm not going to ask you any test questions about that, but they're kind of fun to learn about. They're important too. The primary hairs are the ones you see in some breeds. They're very long and stiff. And then the secondary hairs tend to be softer and shorter. And there's a third hair type, which are called the tactile hairs, right? That's what you're seeing. Those are the whiskers that you're seeing here. And those are important. But I'm not going to ask you much more about primary hairs and secondary hairs. But it is kind of fun, though, because the reason we get, dogs with such variety of hair coats has to do with the different lengths and ratios of these hairs. So for example, a wire-coated terrier is going to have pretty long primary hairs, but with less secondary hairs. But soft and fluffy animals like a sheep or a little dog named Fluffy, they tend to have more secondary hairs. And if you've ever owned a dog or a cat or any animal, I guess they shed, right? And our focus will be on the dog. So, they shed most heavily in the spring and the fall. Different animals shed, differently. Genetics plays a role, the environment plays a role. We say that, let me think this through, make sure I get this right. So they tend to shed very heavily in the fall because they're going to they're going to grow a new thicker coat for the winter, and they shed in the spring because they're going to grow a kind of a thinner coat for the summer. So what gets shed, those primary hairs or the secondary hairs? Well, I think both get shed, and some animals need help, right? They need to get brushed. And you'll see, we'll come back to this question, but sometimes you shave an animal in the winter, maybe they go to a groomer, they get shaved, and the hair doesn't grow back. It doesn't grow back until several months later. Sometimes we'll clip an animal, maybe to place a catheter, we'll shave them, and it'll take months for that hair to grow back. And so we'll see if we can tell you why in a moment. So there are these different phases to hair growth. And again, these different hairs on your body, my eyebrow hairs and my armpit hairs are different than the hairs on my head. And different breeds of dogs, it's a little bit different too. But first, we'll talk about the actual phases. So anagen is when it's actively growing. That's what you're seeing here. Here's anagen. New hair is growing, mitotically active. And then as it finishes growing, it goes into what's called catagen phase, where it's still growing, but now that dermal papillae, I believe, is starting to atrophy. So it's just not going to grow as actively. After that, we enter the stage that I think most hair is in, at least on my eyebrows and my hands and things. And that's called the telogen phase, where the follicle has atrophied. So if you look over here, right, there's that follicle, it's growing, but now it's kind of, it's atrophied. It's no longer connected. The hair is not falling out. It's going to stay there, but it's not shedding, but it's not growing anymore either. So this is called the resting phase. And then exogen is when a new anagen cycle is beginning, and it's going to push, a new hair is going to grow, and it's going to push the old hair out. This is what we call shedding. So when animals, a dog in the spring or the fall, that's what's happening is during the summer and winter, all of these hairs were in telogen, and now suddenly all these new hairs are growing, and it's going to push out the old ones. Now, the book doesn't mention exogen for some reason, but I think it should. It helps me understand what's happening. So know the word exogen. And again, just showing you the same thing, right? Anagen is the active growing phase. Catagen is slowing down. Telogen, it stopped, but it's resting. It's still anchored until a new little baby hair starts growing and the old hair falls out. Something that you'll hear people say, they'll say, my bitch blew her coat. My bitch blew her coat. And this is something that happens when the female dog whelps, right? When she has her puppies, for some reason, it causes it causes her to lose all her hair. They call it telogen effluvium, but it really should be called exogen effluvium, because telogen is the resting stage. Exogen is the shedding stage. So it's a little pet peeve of mine. And the reason I'll just mention, so sometimes we shave an animal in the winter during the telogen stage and no hair grows back. Well, that's because they're in telogen. We'll shave an animal and they'll just stay shaved until the spring, when suddenly exogen begins and now new hair grows. So and there's I don't know if it was one of the topics, I can't remember now, but I think I made it one of the topics, was this thing called shave shock. So we'll see if somebody writes about, called post-clipping alopecia. So we'll see if somebody wrote about that this week. And then we'll let Mr. Hank talk about the difference. Well, he'll tell you what I just told you, but probably much more entertaining than me.
You're probably quite happy that your armpit hair isn't dragging on the floor, so it's good that there's a system to prevent that. But what is that system?
Oh, sorry.
Most humans grow hair all over our bodies, except on our palms and the soles of our feet. But some of it, like leg hair, stops growing, while the hair on our heads just seems to grow out forever. That's because every hair on your body goes through the same cycle, growing for a while and then falling out. But each type of hair spends a different amount of time growing and grows at a different speed. Every hair begins the same way in a phase of the cycle called anagen. During anagen, blood flow starts to ramp up at the base of the follicle, feeding oxygen to specialized stem cells. These cells begin rapidly dividing and producing keratinocytes, which form the root of the hair. As the expanding mass of keratinocytes is pushed toward the surface of the skin, the cells die, releasing a protein called keratin, which holds the strand of hair together. Eventually, that strand pops out of your skin, so the visible part of the hair is entirely dead, which is why, thankfully, it does not hurt to get your hair cut. Though try explaining that to a 3-year-old. During anagen, hair can grow up to 1¼ centimeters every month, depending on where it's located on your body. The second phase is called catagen and lasts about 2 weeks. Here, the blood supply is cut off at the bottom of the follicle, which stops the production of new keratinocytes. So for that particular hair, the party is over. The follicle then shrinks to about 1/6 of its original size, and then the existing hair strand is pushed closer to the surface. The third phase is called telogen, otherwise known as the resting phase, where the follicle remains dormant for 1 to 4 months. Finally, the hair is released or shed when the follicle dilates and starts the anagen phase again. So how long a hair on your body gets depends on how long it's in the anagen phase and how fast it grows during that time. A hair on your scalp, for example, stays in anagen for 2 to 6 years, which is why it can grow so long. Other hair types like eyebrows and eyelashes and body hair have a short anagen phase, only 30 to 45 days. But they also grow much more slowly, with eyebrows, for instance, growing only 4.2 millimeters every month. This is my eyebrow close-up. As for how your hairs know when to grow and when to stop, that's something scientists are still trying to figure out. It is known that genetics can lead to longer or shorter anagen phases in certain hair types, but the current thinking is that your hairs get their instructions by way of chemical growth signals from stem cells in the skin. And considering how extremely inconvenient it would be for all of the hairs on your body and all mammals' bodies to just continue growing forever, it makes sense that there's a system for making sure they don't grow too long. You can thank Griffin Taylor, a supporter on Patreon, for asking us this question. If you'd like to submit questions to be answered or get these quick questions a few days early, you can check out patreon.com/scishow.
Right, so that's really interesting, right? So the hairs on my head, well, they're going to be, I never let them reach, I guess I never really let them reach telogen, right? They're always an anagen. They'll be an anagen for, 2 to 6 years, but I just keep cutting them. But the little hairs on my arm, they're in anagen for about 40 days, and then they stop, and then they get pushed out by other cells, if I'm understanding him. All right, well, what does that have to do with Bailey? And what is the answer to the question? So here was what a dermatologist wrote. He said that poodles actually do shed. They do shed. They just shed less due to the longer anagen phase of their hair cycle. So they shed less hair because the hair stays in the growing phase of the hair cycle for longer. In fact, this is probably why people have to take their poodles to the groomer, right? But I'll let him answer. Most other breeds shed more because their hair grows for a short period and then enters the shedding phase faster, exogen. My dog is always in exogen, right? So she has a longer anagen phase, right? So her hair stays in anagen much longer, and the hairs will grow much longer before she ever reaches this telogen phase. And so different dog breeds have different rates of shedding to their genetics and physiological, environmental, and dietary factors, right? And this was Dr. Janki Bajwa, who is you might see him at a conference. I've read a lot of articles by him. He's great. And this is a quote that he put in his letter. So I have failed at times, but I never stopped trying. Good advice. Oh, that's by someone named Rahul Dravid. Okay. So when a client comes to you and says, oh yeah, this breed is hypoallergenic, they don't shed. Yeah. Okay. So next, glands of the skin, right? So we've been talking about endocrine glands and exocrine glands. We've mostly talked about the salivary glands and the pancreas. Now let's talk about the main glands that you'll probably be dealing with, which are various glands of the skin. I think let's just watch that again. There's a gland, right? This, we could probably say this is maybe this is a sebaceous gland, but it's producing this kind of oil that goes up to the hair and it's kind of coating the base of the hair. Again, these are all lined with epithelial cells. Remember, they're really good at making stuff and absorbing stuff. And so that's what lines these exocrine glands here. So the four types we're going to look at are sebaceous glands, sweat glands, tail glands, and the anal sacs. So first, let's look at sebaceous glands. Here's the sebaceous gland right here. You see it makes it look like it's located in the epidermis, but I think it's located in the dermis. Anyway, it's going to release kind of an oily substance, kind of an oily lipid substance. We call it sebum. And when you see animals with a really nice shiny hair coat, well, that's the sebum. Sheep have a particular kind of sebaceous gland called that makes lanolin that they'll use to kind of spread around their coat. And the notes, we're going to look at the notes here. There's certain benefits, certain functions of the sebaceous gland. So it's going to coat the hair. It's going to help trap moisture and prevent drying of the skin. It keeps the hair and the skin soft and pliant and somewhat waterproof. It actually has some antibacterial and antifungal properties. When we have people give their pets fish oil, so fish oil has what are called essential fatty acids like omega-3 and omega-6. Well, that is to help the sebaceous glands. And then I'm going to show you, we get some problems with these glands. They can get plugged up and form a cyst. They can get infected. If you get excess sebum, they can get kind of clogged. And I'll show you an example of that. And then they can also form a cancer, sometimes malignant, but more often benign. So again, here's a sebaceous gland that's gotten so plugged up that it's formed a cyst. Very satisfying because it's all chunky. It's not an abscess. It's just this wonderful, chunky, oily substance. So these are a lot of fun. So they've made a little, they're lancing it, and then he just opened it with a hemostat, and then I don't know if it's a good idea to squeeze these or not, but boy, doesn't that look satisfying? Just squeezing all that stuff out, right? So that's sebum. That looks great. We see these things called sebaceous adenomas. They look kind of like little pink cauliflowers or warts. Again, these are sebaceous glands that have formed a kind of benign cancer, right? These are not malignant. If they were malignant, what would they be called? They'd be called an adenocarcinoma. But this is not an adenocarcinoma. This is a adenoma. Whenever you see the word that always means gland. So anyway, as a teenager, I had both of these, and I still do, actually. So when these glands get kind of plugged up, they can sometimes turn black, and we call those comedones. Sometimes they will turn white with pus. I'm drawing a blank on why some turn black and some turn white. Maybe during the break, I'll see if the book tells me. But anyway, a pustule would be, anyway, but it's all related to the sebaceous glands getting too much sebum, maybe getting infected, and getting, plugged up in little ways like that. So we'll see a lot of cats. We'll see schnauzers that have these comedones. All right, so those are the sebaceous glands. We're gonna come back to them in a little bit. Now let's talk about sweat glands. Now there's two kinds of sweat glands. One type is called eccrine or eccrine, and the other is called apocrine. And the sebaceous glands, remember, make kind of an oily lipid substance. These make more of a watery substance. They're also further down in the epidermis. That doesn't really matter. And you'll see they're kind of discharging their contents not associated with a hair follicle. They're just discharging their contents onto the skin. I don't recall, I think some might be, if they might discharge onto a hair follicle, others don't. But anyway, these are the sweat glands. The eccrine sweat gland is what, when you and I think of a sweat gland, that's the sweat gland. We are thinking of the eccrine sweat gland. You and I have them all over our body. They're for cooling, but animals don't have them all over their body. They're either going to have them just on their foot pads, or in the horse, just on the frog. It's kind of weird, but that's the only place that they have them. They don't obviously help them very much to stay cool, but they do help a little bit, and they also provide some traction. And it's always kind of sad. You'll see an animal come to the clinic, and you know they're nervous, and you'll see the little wet footprints they left because they're sweating so much from their little foot pads. But they do help with cooling. This is why if we have an animal that's overheated, you'll often see people pouring, having fans or cool water, sometimes rubbing alcohol on their pads. Although I want to say the advice now is not to put alcohol on their pads, but I'd have to check that. This type of sweat gland, the apocrine, is a little weird. It is a sweat gland, but it doesn't really do what you might think. So these ones empty onto the follicle, not the skin, right? So those other glands, the eccrine ones, those are the ones that will empty onto the skin or discharge. These ones will empty into a follicle. Now, they mix with sebum, and so the sebum and the apocrine watery substance together helps to form this protective barrier. This watery substance is also what causes body odor in people and in animals. And horses can generate quite a bit of wetness from these glands. You'll see horses having sweat on them. It's actually from the apocrine gland. But I could not confirm whether it has a cooling effect. I think it must, but I could not confirm that. So like I said, there's the sweat source and the smell source. And these glands can also can form cysts, and they can form little cancers. These tend to be more round, these little adenomas. So people will come in and you'll draw fluid out. The person will come in with this lump, and you or the doctor will do a fine needle aspirate, and you'll pull out fluid. That's an apocrine cyst. Actually, that would probably be a cyst you would draw the fluid out of. The tumor would probably be solid, but again, it's benign. If it were malignant, it would be called an adenocarcinoma. and it would be a much more aggressive tumor. Earwax. What is earwax? Well, earwax is actually both sebaceous and apocrine gland secretions mixed up together. And of course, I'm sure it helps the ear. It helps dog ears, but there are certain breeds of dogs that have more of these glands than other dogs. And so they make more earwax, and that actually increases the risk of them developing otitis externa. And do you know which breed that is? Which breed of dog? Yes, the Cocker Spaniel. They have way more glands in their ears. And so it's not because they have the floppy ears. There's a lot of dogs with floppy ears that never get ear infections. It's because they make so much freaking earwax, and that's kind of a food source for bacteria. The floppy ears probably don't help. Okay, they probably don't help. But a big part of it is they just have a lot more glands. And so the ears are just kind of, in general, they tend to be kind of darker and moister and juicier than other ears. So this is a gland I don't really think about very much, but it's there. It's called the tail gland. You can't really see it normally, but some animals will get what's called a tail gland hyperplasia, where they'll lose hair there. They call that stud tail. But apparently it aids with recognition and identification. So maybe when dogs are sniffing each other's rear ends, maybe that's part of what they're sniffing. It's made up of the two types of glands, sebaceous and apocrine. And then anal sacs are, again, these are glands. We talked a little bit about them in discussion last week. We think they can play a role in marking and identification also. Maybe they help attract a mate. Kind of disgusting. Again, located at kind of the 5 o'clock and the 7 o'clock position. And as we learned last week, they can get infected or impacted kind of based on their location. But again, it's a gland. Okay, so let's take a moment. You've all taken medical terminology, so we're going to take a little moment to review skin lesions. We're going to use some, not a lot, but we're going to use some of the most common terms in medical terminology to describe some lesions. And the good news about the skin is that you can see it, right? You can't see the heart, you can't see the liver, but here's an organ system that you can see. That makes life very easy, or easier. The bad news about the skin, about the integument, is that it has a limited repertoire. And what that means is it has a limited number of ways of dealing with a problem. In other words, 10 different diseases can all look the same. So keep that in mind. And so I'm going to show you some lesions, and then we just try to sort of think to yourself, like, well, you know, how would you describe this over the phone if you were, you know, if you were trying to call another RVT or a doctor and you just wanted to explain it? Well, how would you, you know, I guess you could just take a picture of it, but let's say you had to use words. How would you describe that? Compared to this, how would you describe that? It's not the same. How would you describe this? Right, that's also different. So with all that in mind, let's review some medical terminology here. Right, so for itching, what do we call that? Right, that's called pruritus. Hair loss, that's alopecia. Alopecia, we can use other words to describe it. So for example, if the alopecia is on two kind of mirror image sides, we call that bilateral alopecia. If it's just in one spot, we might call it focal alopecia. Again, we can use these words bilateral and focal with other things, not just alopecia. If it's all over the body, we might call it multifocal alopecia. Like this horse we saw, right? This is sort of multifocal alopecia and scaling on the horse. And if it's all over, then we say it's generalized. That is one weird looking horse. When the skin is red or inflamed, we can just use the word dermatitis. It's a very non-specific term for inflamed skin. It might be infected, it might not be. When it's infected, we use the word pyoderma, and that's just kind of a non-specific term for infection. And when it's infected, you'll know because it's not just red. Now it's got, these look like little pustules. We get these things called collarettes, these just kind of little red circles. That's some sort of bacterial infection. What about this? How would that be described? It's kind of red. It's also really dark. It's just sort of this thick elephant skin. Well, that thick, kind of lumpy, bumpy skin, we call that lichenified because it looks like lichen. If you go to the ocean and you see lichen, it's kind of what it looks like. And then we say it's hyperpigmented. These are signs of chronic inflammation. Chronic dermatitis will cause lichenified and hyperpigmented skin. And that's lichen. So lichenified and lichen. And then if you're a Game of Thrones fan, that kind of looks lichenified. You've got chronic dermatitis, my friend. Okay. You'll see animals that have this kind of odd, looks like all these little hairs, fronds growing from the nose and the pads. That's called hyperkeratosis, right? The word keratin and keratinocyte or keratinocyte, if you prefer. Right, so this is hyperkeratosis. You'll see animals licking their feet because they itch or they're pruritic, and that's called salivary staining, this kind of a wine color. We can get ulcers on the skin. I showed you earlier acne. That's really called a comedone or pustules. I think I misspelled it. I misspelled it comedome. It's really spelled comedone. You'll get these hard lumps, and this is a little arbitrary, but if the lump is less than a centimeter, it's called a papule. And if it's greater than a centimeter, they call it a nodule. Okay. Petechia, you've learned before, it's not really a problem of the integument, but it's worth bringing up again. And then urticaria are these little soft bumps all over the body. This is from an allergic reaction. It would also be called hives. On ears, you'll see little cracks. We call those fissures. If we get this kind of like, like lots of scabs, you could call it scabby, but the proper term would be crust. And then sometimes we use multiple terms, right, to describe things. So one way we could describe, if I were writing a medical record or if you were with me and you wrote it, how might we describe this? It's certainly, there's hair loss, so there's going to be alopecia. It's focal. There's focal alopecia. There's erythema. There's a few other words we could use that I didn't mention, like excoriative. That means there's been self-trauma. Erythematous means red. It's acute. We can tell it's acute because it's not lichenified, is it? It just looks very fresh and red and kind of moist. So there's lots of different ways you could describe it. It's always useful to say whether it's mild, moderate, marked, or severe. So anyway, that's one way we could describe that lesion. And if you'd like, you could stop here and go to Quizlet, and also you could check some more of your answers. But Quizlet, again, some of my choices may seem a little subjective to you, but it just has these different, these and a few other pathology terms for skin. All right, we're just going to continue. This is the final part here. We're going to look at a few problems involving hooves and nails and things like that. So look at this horse. Look at how this horse is standing, right? He's kind of leaning back on his feet there. It's kind of an odd way of standing. Watch how this guy walks. He doesn't look like he wants to walk. Right? They're just these very short, very guarded, yeah, incredibly short little steps. If he could talk, he would say, it feels like I'm walking on millions of sharp needles. Okay, that's what he would say if he could talk. So what do we think of him? What is the quick? And if an animal tears off its nail, it'll grow back. Why? When we dehorn livestock correctly, why does the horn not grow back? And if we dehorn livestock incorrectly, the horn will grow back in this crazy little skir. Why? And back to that first horse is, what is the lamina and what is laminitis? That's what this guy has. There's a problem with his hooves. They are really, really painful. Right? This guy hardly wants to even walk. Ouch. 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 Okay. So we're going to answer those questions. And again, whether we're talking about skin or pads or claws or hooves or horns or, I can't see what I wrote here, or even hair, we're talking about the same thing. It's a group of mitotically active cells, right? The matrix of the hair follicle or the stratum basale of the skin or claws or hooves. They're producing this epithelial cell called a keratinocyte. Again, it's pushed upwards, it fills with keratin, it dies, and it hardens. And that's what we see in all of these. These are all the product of these mitotically active keratinocytes. So we're going to look at them. Let's look at foot pads first. The outer surface is composed of the same 5 epidermal layers. Why did I say earlier there's only 3? Well, maybe because we only care about, like the outermost layer. So this is the toughest and thickest part of a dog's body or a cat's body for that matter. The stratum corneum, right, that outermost layer is so thick. It's way thicker than in you and me. It's actually thicker than the other layers combined. And like we said, it contains those eccrine sweat glands. And these foot pads, they heal really slowly. Whenever a patient comes in with that injury, it's going to take a long time to heal. And if we took a cross section of a pad, right, you saw earlier some cross sections of skin. Look how gigantic the stratum corneum is. That is a lot of stratum corneum. And then there's the rest of the epidermis there. And then here's the dermis. There's also a lot more fat and connective tissue in the pad. So something about this really gigantic stratum corneum just means that it's going to take forever to heal. Again, these take, probably 3 weeks or more to heal. And so I'm going to ask you this question again and again. So is this epidermis or dermis? And is this epidermis or dermis? Well, this is dermis, right? There's blood vessels, there's nerve endings, there's connective tissue. This would be the epidermis. Let's look at the claw. Now you can kind of use your own nails here, but it'd be more helpful if you picture a dog or a cat. So the claw is just essentially a specialized epidermis. Instead of skin though, this hard substance, it's still keratin, but this structure called a claw forms. Again, it's got this dense stratum corneum that's growing outward from this mitotically active epithelium, down by the stratum basale. But instead of being skin or a hair, it's going to form this this claw. And then underneath that claw, we have the corium, which is the dermis. It's basically the dermis. I don't know why they don't just call it dermis, but it's attached to this underlying bone. That's P3 there. So the corium is basically the dermis, right? The nail here is basically, the stratum corneum, and I'm sure the rest of the epidermis is in there. There's another term you may know for the corium, and what is that? Right, that'd be the quick. So the quick is the dermis. And of course, if you ever do a nail trim, right, we try to cut them here because there's no nerve endings, there's no blood. If you cut them on the quick, well, it's kind of like a paper cut. Now you've cut the blood vessels, you've cut into nerve endings, right? It can really hurt. And it's just showing you a cross section of a foot, or this is a cross section of a dog or a cat's digit, right? So there's the first phalanx, the second phalanx, the third phalanx. We've got this dermis that surrounds it, or they call it the corium, and then again we've got the epidermis growing off of that, with the claw being the keratinized stratum corneum, and same with the pad. So just showing you both the pad and the claw. That's basically stratum corneum. So again, the quick is that epidermis or dermis. It's dermis. And that means the nail would be epidermis. All right, hooves, same thing. There's one other kind of interesting thing about horse hooves. Hooves we find in what are called the ungulates. There's the one-toed ungulates and two-toed ungulates. Are there three-toed ungulates? In the one-toed ungulates, like horses and zebras and donkeys, they're basically walking on their middle finger, okay? They have these little vestigial second and fourth fingers, but they're basically walking around on I just ignore that I did that. They're walking around on their third digit. And again, the structure is going to develop, the hoof is going to develop, as part of the epidermis, as part of this stratum corneum. Now it's a little annoying that they use this word corium twice. They use it with an E for stratum corneum, and then they also use it for this thing called the corium, which is different. So again, we're looking here, this is basically, this is like the quick of, or the dermis of a horse. One second here. So if we were to remove a horse, this horse is dead. Okay, this is not a live horse. If you took the hoof off, we'd find this modified dermis, right, the corium, and this is what's attached to the bone, right? So this helps ultimately hold the bone. The bone attaches to this, the dermis, and then the dermis attaches to the hoof. The bone, of course, here being P3, or the coffin bone. Right, so there's the coffin bone, there's the dermis, and then we have epidermis, the hoof growing off it. So, but again, they don't call it dermis, they call it corium. And it gets a little confusing because they give the corium different names depending on what portion of the hoof that it's produced from and that it's maintaining. So the part between the hoof wall and the coffin bone is called the laminar corium. Laminar, kind of means lines, and that's where the word laminitis comes from. Laminitis is referring to inflammation of the laminar corium. And so again, if we were to take a horse's hoof and remove it, we would see again this sort of the laminar corium here on the that's around the bone, right? That's the dermis here. And then we would also see lamina on the actual hoof wall. They call this part here does not have any nerve endings because it's part of the epidermis. This part here has a lot of nerve endings because it's part of the dermis. This design of these little ridges, there's a few functions. So one is that the lamina is going to provide nutrients to the hoof, right? So just imagine this hoof back on that part of the foot there. The blood vessels of the lamina can nourish the hoof, keep the hoof healthy. But also you see it's kind of like Velcro. This allows the hoof to stick to the laminar corium like super Velcro. And that's important when you think about everything that a horse's hoof has to go through, right? We've seen this before. You know, it's amazing those hooves don't just fly off. There's so much force put on them. You know, we see dogs that rip their nails off accidentally, and people can too. But horses, as far as I know, I don't think they rip their hoof off very commonly. But we sure see it in dogs. And again, this is just showing you a hoof that's been removed. This would be a dead horse. And you're going to see, first of all, here's the lamina of the corium. So this would be called the sensitive lamina because it's got blood vessels, or I should say it has nerves. And then now you're looking at the hoof, the lamina of the hoof. That would be insensitive. There's no nerve endings there, right? And again, those two go together. So we're talking about all this just to help you appreciate, to help us appreciate laminitis. It's a very horrible, painful disease in horses primarily. And so we're going to watch this video. And so just as you watch, let's ask ourselves, what role does the digestive system play in laminitis? You'll see that laminitis starts out basically as a digestive problem that shows up in the integument. What are some of the more common causes of laminitis in horses? And then she's going to use the word founder, and you'll often hear people use the word founder and laminitis interchangeably, but according to her, they're not the same, and I'll let her explain.
Hi everyone, and thanks for joining us. My name is Dr. Tanya Cubitt and I'm the consultant nutritionist to Highgain. We're here today to talk about the most common, disabling and painful disease in horses, laminitis. We'll discover what laminitis is, what it looks like in the horse, and further investigate digestive and metabolic causes. We've all heard the term laminitis in horses before. Some of you may have had a horse that suffered from laminitis. It's really quite a complex disease to understand, and that's exactly why we're here to discuss it. By the end of this video, you'll have a better understanding of what happens in the horse's body, especially in the horse's hooves, and the many different causes that can trigger this terrible disease. Okay, so let's start with the term laminitis. It literally means an inflammation of the laminae of the horse's foot. Laminae refer to the insensitive and sensitive tissue that's located between your horse's hoof wall and the coffin bone. The laminae are tiny finger-like structures that interlock and secure the coffin bone to the hoof wall and keep the bone in place. If the blood flow to these laminae is disrupted, inflammation can occur that weakens these tiny structures and interferes with the wall-to-bone bond, making the laminae unable to hold the coffin bone in place. In severe cases, the laminae become extremely weak and no longer hold the coffin bone in place. The weight of the horse pushes the coffin bone towards the ground, and the pull of the deep digital flexor tendon rotates the coffin bone, which will sink and rotate within the horse. This process is extremely painful to the horse and results in lameness and sloughing of the sole of the hoof. In some cases, the coffin bone will actually protrude through the sole of the hoof. Laminitis can affect one or all of the feet, and is often seen in the front feet simultaneously. There are two terms that people use interchangeably, laminitis and founder, but they're not exactly the same thing. Acute laminitis refers to the symptoms associated with a sudden initial attack, including pain and inflammation of those sensitive laminae, whereas in severe cases, it's likely to leave behind a permanent reminder, which we call founder. It's an internal deformity of the hoof occurring when those supporting laminae die and allow the coffin bone to rotate downward. Now that we have a better understanding of what laminitis is, we need to investigate what triggers this horrible disease. While the exact mechanisms by which the hooves are damaged remains uncertain, there are several situations that are known to result in the onset of laminitis, ranging from nutritional to mechanical factors. Some of the causes of laminitis include a serious case of colic or untreated infections, metabolic disorders, mechanical separation, retained placenta, or even stress. One of the most common causes, though, is a nutritionally induced laminitis, specifically through a carbohydrate overload. The horse is designed to digest carbohydrates, starches, and sugars in the small intestine and fiber in the hindgut. However, if the capacity of the small intestine is exceeded, the digestion of these sugars and starches will then overflow into the hindgut, and they'll upset the microflora, which in turn increases the acidity of the hindgut. The developed bacteria designed to utilize lactic acid, they can't keep up with those producing it. They die, create a toxic environment, and are released into the bloodstream. This toxicity to the blood vessels in the laminae will result in a disrupted blood flow, causing the inflammation, as we explained before. Certain types of horses are prone to laminitis, such as...
So I'm going to stop there. Now, obviously, that gets a little bit complicated, right? Like, what is that? The carbohydrates made it to the colon, and now it's acidosis, and oh my gosh. But the point is that diet, this is why we don't feed Levi alfalfa. We don't feed Charlie a bunch of grain, right? They don't need it, first of all, and second of all, it could set them up for laminitis. They're already at risk for laminitis and a few other problems. But all right. But the main thing is that it's inflammation of the feet, and there's can be a lot of different causes. But any sort of a diet that's too rich, lush pasture, too many carbohydrates. Again, it can start in the digestive system, but then it can create problems in their feet, of all places. So everything's connected. All right, horns. So I just had to dehorn Phoebe a few weeks ago, and he's doing well. That's the little lamb that was donated to us. So horns, again, same sort of thing. They're epidermis. They're bound to corium, right? This sort of modified dermis. They're made of keratin, of course. And we asked earlier, well, how come if you dehorn correctly, nothing grows back, but if you don't dehorn correctly, stuff grows back? And we find that when we dehorn, you can't just remove the epidermis. You've got to destroy part of the dermis as well, right? The blood supply, that first layer of the epidermis, you got to get rid of it all, or else we'll get a new horn growing. The opposite would be a dog that maybe tears its nail out. Well, it'll grow back, right? So long as there's still some of that epidermis left, a new nail will grow. So I thought you might find it interesting. This is what I did with Phoebe just 2 weeks ago. I did just what this vet did. So we'll watch this. What you're going to see, the way you know that that you've dehorned enough is you'll see this copper color. The copper color, it's the corium, it's the dermis, and that when you see that color, then you know that you've dehorned enough. And you'll see several different things when he dehorns. We don't want to do it too long because it can cause a thermal meningitis. So you just dehorn a little bit and then you stop. And you dehorn some more and then you stop. So we'll watch this.
This is Margarita. This is Maplethorpe. This is Fry. And that's me, Manali. This is the Wild One Walk Day.
Hello. I got to run out to the barn today.
So there's the veterinarian. So he gives them alpha-2 agonist. He gives them an opioid. Right, just a little bit at a time.
So what we're doing is
You could do a lidocaine nerve
burning all
block.
the tissue around the base of the horn. And with cattle, when we do this, you basically put the iron on for as long as you want. The cattle have fairly thick skulls, but with goats, because the skull is so thin, you really only leave it on for a couple of seconds at a time. And your objective is to get this nice copper-colored ring all around the base of the horn. So I do where you need to, and then I add a little margin to try to prevent those scurs that I had mentioned earlier. And you'll also notice as I'm going around, I'm deviating a little more toward the midline or the center of the goat's skull, because they do have scent glands up in that area. And this will make a much nicer pet if it doesn't stink as much when it's an adult.
Wow, that's a great plus.
Yeah. I hope you're watching carefully, JJ, because Dr. Miller may have you do this tomorrow.
Oh, do we have a bunch coming out tomorrow?
There's a bunch that Dr. Miller is going out to do, and she threatened to stay in the car and leave JJ there to do it.
Hold on.
JJ is actually a graduate veterinary student from India. So
That means I'm going to be stuck doing it too. What I'm going to give them now is antecedent, and this wakes them up from the anesthesia. It takes a couple of minutes, but it'll.
Okay. Yeah, so you saw just a couple of seconds at a time. I actually did not know that about scent glands. That's interesting. I don't think I did that on Phoebe. So anyway, and the book tries to explain this. This is not going to be on an exam, but this always kind of baffles me that horns and antlers are quite different. Animals lose their antlers every year. The males do, I guess, right? But horns, right? Nobody loses their horns. So they're kind of cool, but I'm not going to ask you about that. Okay. All right. So you could certainly ignore that part from last week. So you could check the rest of your answers. Again, there's that Quizlet you can practice, and then contact me with any questions as we go forward in our last kind of lecture with the imaginary bagels. Okay, everyone, it's been really a great year, a little bit weird. This was not how I wanted it to end, but it's been a little bit that I got to see you this year. That was great. Okay, so we're going to go forward and things are just going to get better. All right, you take care.